A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. Dr. Peter Hotez is a pediatrician, vaccine scientist, and professor at Baylor College of Medicine in Houston. He co-directs the Texas Children's Hospital Center for Vaccine Development and serves as Dean of the National School of Tropical Medicine. Dr. Hotez has led vaccine development for parasitic diseases and COVID-19, that's where we met him last, with 2 low-cost COVID vaccines reaching 100 million people in India and Indonesia. He's a leading advocate against anti-science and anti-Semitism. He's authored over 700 scientific papers and 4 books. He is a member of the National Academy of Medicine and the American Academy of Arts and Sciences. He frequently appears in major media and was named to Time magazine's Health 100 in 2024. Dr. Peter Hotez is our guest for this special edition of your Hometown Health Connection. I'm John DeSciullo. Welcome to this important discussion. Our guest, Dr. Peter Hotez, will address the urgent need to separate medical fact from fiction amid a surge of misinformation about vaccines, treatments, and disease origins spread rapidly through social media and amplified by the current administration. The Make America Healthy Again report, led by Health and Human Services Secretary RFK Jr., cited hundreds of studies, some of which were reported to be AI-generated or even non-existent. Our political appointees overriding scientific oversight with peer-reviewed research funding being slashed, impacting critical work on cancer, Alzheimer's, and other research. In Buffalo, for example, Roswell Park and the University at Buffalo Medical School have lost millions in vital research support. Dr. Hotez joins us from Baylor College of Medicine in Houston, again on your Hometown Health Connection program. And Doctor, we thank you for your time. Let's start with an important question. How would you define the scientific disinformation and how it is different from misinformation or skepticism?
Well, the misinformation doesn't imply intent. It could just be bad information. The disinformation it means something more nefarious. It means that it's deliberate. And unfortunately, in this case, you know, as you point out, the Maha movement weaponizes a lot of science information in this campaign of disinformation, and it's really, in some respects, waging war on the American people at multiple levels. And this is unfortunately our new Department of Health and Human Services. And we can go through it because it's so multifaceted. It's happening at the levels of the Food and Drug Administration, at the Centers for Disease Control, at the National Institutes of Health. And it's coming from the Secretary, Robert F. Kennedy Jr. himself in his public statement. So it's really a war of anti-vaccine, anti-biomedicine disinformation. That's probably the most succinct way to describe it.
What are some of the most common sources of scientific disinformation? Would you say it's social media, the political world, and their messaging that you just cited, or elsewhere, or all of the above?
It's really all of the above. It's happening on podcasters that are committed to this kind of anti-science, anti-health disinformation. That's one source. It's coming from some of the cable news channels, and historically, in the last few years, it's Fox News has been a big perpetrator of health disinformation. That's documented by 2 groups, Media Matters for America and a research group out of the Federal University of Science and Technology in Switzerland. So cable news channels, it's coming from podcasters, clearly social media, particularly X, after Elon Musk invited back some of the most toxic anti-vaccine activists. Their books on Amazon. If you were to go to Amazon.com and type in the word vaccinations, the top 30 plus books are all anti-vaccine disinformation books. So it's really quite pervasive, and that's why, you know, primary care physicians, internists, pediatricians, OBGYNs feel like they're under siege because their patients are coming in, or their parents of the patients are coming into their office, downloading this, and they're making the docs feel like they're not keeping up with the biomedical literature. They're keeping up, but they're not keeping up with the fake stuff, which is outpacing the real information.
Wow, how conflicting that must be to be a medical expert in any medical area and deal with that, like you said, coming from the patients. You discussed the red-blue divide, and I've heard you talk about that
if you don't mind, John, let me just give you because I like case studies because I think they help people understand. So we had the Florida Surgeon General, Dr. Latiposen, who was an ardent anti-vaccine activist, come out and say that mRNA COVID vaccines are causing turbo cancers because they're delivering a package of nucleic acid into our genome and next to oncogenes. Sounds pretty plausible, doesn't it? Until you realize that there's no such thing as a turbo cancer. That's a totally made up term. And then the mRNA lipid nanoparticle will deliver nucleic acid past the cell membrane into the cytoplasm, but it doesn't get into the nucleus. For that, we need electroporation. And even if it did, we have proteins of our innate immune system that would block integration into our genome. Otherwise, every time we eat a hamburger, we'd have cow DNA into our genome. And that's why it's all kind of BS and made up. But the average physician, would have to go digging into their biochemistry and molecular biology textbooks to kind of figure that out. So they don't have the accurate information handy in order to debunk that. And so they're kind of left shrugging their shoulders. And then you have one more patient or one more parent of a patient who's declined an mRNA vaccine as a consequence.
It's an amazing time to be in your profession. You discussed, I was going to jump into this question before you offered that important case study. You've discussed what we look at as the red-blue divide. Can you tell us about your thoughts on that?
Yeah, this became more apparent. It was growing for years, but it became most evident during the COVID pandemic after vaccines became available in 2021, 2022. Beginning with the Delta wave the last half of 2021 and the BA1 Omicron wave in the early 2022, you started to see widespread vaccine refusal and people dying because they refused COVID vaccines. But Charles Gaba, the health analyst, did an analysis to show overwhelmingly this is happening in Republican majority states, what we call red states versus blue states. And in fact, the redder the county, meaning the higher percentage of Republican voters, the lower the immunization rate and higher the death rate. So much so that David Leonhardt of the New York Times would label it red COVID. And it's not that we care about people's politics. That's your right as an American citizen. But how do you say don't adopt this? Because what was happening is what you saw across especially the rural, we call them conservative. I don't even like to use the word conservative. It's not conservative in the classic sense, but of course, rural conservative areas of the country, widespread COVID vaccine refusal and extraordinary death rates. And now that's spilling over into childhood immunizations. So it's no coincidence that our terrible 2025 measles epidemic that's been going on since January is occurring in the same areas that people died because they refused COVID vaccines in West Texas, up in the Panhandle, into Oklahoma and Kansas. And so this is becoming pervasive not only for COVID vaccines, but childhood immunizations as well.
I don't recall ever a time, or maybe I just wasn't as aware of it, where politics and medicine were so aligned and where people were so passionate in their beliefs one way or the other. Has there ever been a time in our history that we've seen something like this in the past?
Not so much so you have anti-vaccines. I mean, anti-vaccine activism, if you look at the history of our country, it kind of goes up and down, but where it's really gained critical mass and caught fire is because it's been adopted now by the far right of the Republican Party. We used to be called the Republican Tea Party, and now we call it MAGA/MAHA. It's this kind of libertarian philosophy. But the other component, John, is there's a converging thread here. It's not only this kind of libertarian health freedom, medical freedom philosophy, because converging along with it is a very corrupt health, wellness, and influencer industry, which makes its money by buying up low-cost generic antiparasitic drugs such as ivermectin or hydroxychloroquine or fenbendazole. You ever wonder where all the nonsense about, hydroxychloroquine or ivermectin came from? It came from the health, wellness, influencer industry, buying up this stuff in bulk because it's available, cheap. They repackage it, and then they'll sell it along for thousands of dollars with a telehealth visit. That's the business model, and so you have that component going as well. So this explains, why you go, we've got podcasters like Joe Rogan pushing, or pushed ivermectin during the Delta wave. It's where, the stuff on Fox News comes from. So it's this convergence of libertarian philosophy and Maha wellness influencer industry. And now, unfortunately, it's in power in the Department of Health and Human Services.
What do you think, Dr. Hotez, this is having the impact on this, the disinformation impact in the public trust in science and scientists like yourself and others?
Well, it's undermining. It's really interesting how some of the leaders of this, who are now in positions of power in various agencies of health and human services, say that they're doing this to restore trust in medicine and science, when in fact the public has always had trust in science and medicine until these guys came along to create the distrust. So that's very concerning, because the other component of the Maha and libertarian philosophy is for their business model to survive, they have to discredit mainstream biomedical science. And this is where you're starting to see this portrayal of vaccine scientists, virologists as public enemies or cartoon villains. It explains why they're threatening research universities with an endowment tax. It explains why they're cutting off the NIH budget, looking at a 40% decline in the NIH. This all comes out of this anti-science movement, this convergence of libertarian philosophies with the Maha influencer movement.
We're talking with Dr. Peter Hotez, pediatrician, world-renowned vaccine scientist, professor at Baylor College of Medicine. You've seen him on national and international television shows and podcasts and on YouTube. Dr. Hotez, the spread of false information, how has it changed the way people receive and interpret their scientific evidence? Are they, as you said, starting to believe what they believe on the political side versus what they should believe with the scientific explanations that are more valid?
Well, in a sense, all of the above. So what do I mean by that? When you look at the history of propaganda and either from authoritarian, especially in authoritarian regimes, whether it's Stalinist Russia or Weimar Germany, the use of propaganda is very strategic, and it's not. And the goal of propaganda, and I had to take a crash course in political science to understand that. I had to read sections of Hannah Arendt's Origins of Totalitarianism. What do I know about political science? But I've been trying to do some quick learning. The goal of propaganda is not to get you to believe the lies. That's not the goal of propaganda. The goal of propaganda is to confuse you, to flood the zone, as Steve Bannon would say, and so that you're not certain what to believe anymore. And that's what this Maha movement is doing, and that's what this this effort's all about.
We've talked about the political divide. What are the demographics of the people who might be vulnerable to some of this disinformation? Is it older people, younger people, a mix of all races and ages, and why?
Well, when the Kaiser Family Foundation looked at it, people who are refusing COVID vaccines, and it clearly needs an update because it's a couple of years old now, is, one was your political leanings, but the second most important was low educational attainment. And with that, absence of critical thinking. So it's, and those are the individuals that are being targeted. And it's important to remember that if you have a patient or the parent of a patient who comes into your clinic or office and espousing anti-vaccine views, it's easy to get annoyed or frustrated with them. But you have to remember that they themselves are victims. They were targeted by this disinformation campaign, and so it's quite deliberate.
You cited a situation earlier in our conversation about an individual involved in some misinformation and what it meant. What are some other stories that you can share, maybe some examples, dangerous examples of how medical disinformation can help or hurt people, and what you may have encountered recently?
Well, it goes across a range of things. I mean, the original assertion against vaccines, of course, were false statements that vaccines cause autism, and that's how I got involved, because I'm not only a vaccine scientist, but I'm the parent of an adult daughter. Rachel has autism and intellectual disabilities, and back in 2017, I was asked to talk to Mr. Kennedy, which I had conversations with him for a year. And that led to my writing a book called Vaccines Did Not Cause Rachel's Autism, that was published in 2018. And unfortunately, that's now being resurrected. So we still have, this lack of plausibility and this lack of an enormous amount of data showing there's absolutely no link. But then it moves on, and remember that too has moving goalposts, because within the space of false claims that vaccines cause autism, you had first it was the MMR vaccine, and that was in 1998. Then Mr. Kennedy wrote an article in Rolling Stone magazine saying it was thimerosal preservative, and each time the scientific community debunks it, or it's spacing vaccines too close together, or alum in vaccines. So that's fairly exhausting. And then it was HPV vaccine for cervical cancers and other cancers. They said it was causing infertility or autoimmunity with no evidence for that, or even any plausibility. And it continues on into all of the disinformation about mRNA for COVID vaccines.
You mentioned your daughter has autism, Rachel, and we wanted to talk about that. First of all, how old is Rachel, Doc?
Rachel's now an adult. She's 33 years old. She lives with us. She has my wife and I, she can't live independently. She has a verbal IQ in the 80 to 90 range, a functional IQ in the 40 range. She works at Goodwill Industries. She has a great life. She has friends. She goes to the movies. In spite of what Mr. Kennedy said about people on the autism spectrum, with his very dark portrayal of people on the autism spectrum, saying they can't use the toilet and they will never have a job or pay taxes. Rachel pays taxes, has a job, and has friends, and goes to the movies. That's yet another aspect of this.
Yeah, and we've had some interns here at our television station who have been diagnosed with autism, and having them work through in a professional environment gives them a great sense of pride. Did Rachel get the MMR vaccine? And if she did, were you concerned about that?
Yes, she did get the MMR vaccine. No, I had no concerns, and I'll tell you why. One, we have enormous scientific evidence showing no link between the MMR and autism. This is done through large cohort studies. First of all, the original claim, around 12 kids, that was published in The Lancet, that was shown to be a fraudulent paper and retracted. But it was since followed with large epidemiologic studies showing you kids who get the MMR vaccine are no more likely to acquire autism than kids who don't get the MMR vaccine. But also, John, the other really important element of this is there's lack of plausibility, because remember, autism begins in early fetal brain development through the action of autism genes. There's been about 100 autism genes identified. We identified Rachel's autism gene through a genomic sequencing, all involved in neuronal connections, so this is all happening in the early processes of fetal brain development. It doesn't mean that there's no environmental influence. It's just that if it does, it's an exposure in early pregnancy. Let me give you an example. If you're pregnant and not aware of it and on an anti-seizure medication called Depakote, otherwise known as valproic acid or valproate, that medication interacts with your autism genes and increases the likelihood your child will be born with an autism phenotype. And I remember having that discussion with Mr. Kennedy. I said, Bobby, there's about half a dozen chemical exposures we can identify, all in early pregnancy that can contribute to autism. You're an environmental attorney. You should be all over this. And he had no interest. And which was puzzling because then a couple of weeks ago he comes out and he says we're going to find the cause of autism. Well, first of all, saying you're going to find the cause of autism is like saying you're going to find the cause of cancer, right? It's a complex interplay between autism genes and the environment. And he made this false statement. He said the scientific community is saying all of the rise in autism cases is due to shifting diagnostic criteria, and that the scientific community denies any link with environmental exposures. And I said, it's absolute nonsense. It's the opposite. I sat down with you, Bobby, and identified a list of chemical exposures and even wrote about it in the book. It was you, Mr. Secretary. You had no interest in the environmental exposure. So the disinformation continues.
Disinformation and the research continues. I know that you're looking into the gene that causes autism. You mentioned that. But going back to your association with RFK, I have to believe there were others like you who disagreed with him. Was he hearing from other voices, not just yours?
I would imagine so, but he has this fixed belief, and my impression of him at the time, and nothing he's done has changed, is he's not interested in the science. Well, either he can't understand the science or he has no interest in trying to understand the science. He has his own agenda that he wants to push.
One more question about the MMR vaccine. Do you think it makes sense to conduct clinical trials? If not, why not?
Well, if you look back at the early papers, there were clinical trials. There were randomized, placebo-controlled clinical trials, not only with the MMR vaccine, but with each of the three components. The MMR stands for measles, mumps, rubella. So this has been about one of the best studied vaccines you could possibly imagine. In fact, when I developed new vaccines, we made a low-cost COVID vaccine that reached 100 million people in India and Indonesia, bypassing big pharma companies. And now we have vaccines for parasitic diseases. When we design our vaccines, our gold standard is the MMR vaccine. That's what we aspire to make, something as good in terms of effectiveness and as safe as the MMR vaccine. It is the gold standard of vaccines. So for him to discredit it is absolutely ludicrous.
You've been in this game for a long time. What advice would you give newbies coming in, students or early career scientists, about responsibly engaging with the public and all of these controversial scientific issues? What would be your advice to new medical experts coming into the field?
Well, I think it's good that you want to be out there in the public domain. I think not enough Americans even know what a living scientist looks like. Research America, a policy group, does these studies every few years, and the numbers are always about the same. 75% of Americans cannot name a living scientist, and so we're too inward looking. So I think it's good to be out there, but be strategic in what you do. People think immediately about social media. I actually find social media to be the least rewarding of all of the forms of public engagement I do relative to the books and papers that I write and the podcasts. But my advice is, especially if you're in an academic health center, have a conversation with your head of communications and let them know you're interested in public engagement, and get a sense of the ground rules of what they want to see, what they don't want to see, because you don't want to get yourself in a bind where you're out there engaging the public and finding out that it puts you at odds with the leadership of your academic health center. So if you have that conversation with your head of communications, that's a way to establish a relationship, and oftentimes they'll work with you to identify opportunities for public engagement.
Tell us about the research that you're working on right now, currently in your office there at Baylor.
Well, in our scientists in our labs at Texas Children's Hospital Center for Vaccine Development, we developed a new hookworm vaccine, hookworm anemia vaccine, a leading cause of anemia in low and middle income countries. This is a project I began as an MD PhD student a long time ago, and now it's showing high levels of protection. We're excited about that. We have a new vaccine for Chagas disease, which is another neglected parasitic infection, hoping that will go in clinical trials soon. We're also now moving into non-communicable diseases. So we've teamed up with a group at the Baylor Cancer Center around triple-negative breast cancer to see if we could develop an mRNA vaccine for triple-negative breast cancer. So I'm excited about moving to that area. And then we're looking at the rise of tropical infections here in Texas and the Gulf Coast due to climate change and urbanization, and trying to develop using omics, genomics, and metagenomics to for mosquitoes, doing the whole genome to identify their viromes, to do create an early warning system for due to shifting climate patterns and urbanization here on the Gulf Coast. So a lot going on.
You bring up an interesting point. What vaccines should people be taking today, and would that be regional, like where you are in Texas? The vaccines that the population needs to have there might be different than where we are up north in Buffalo. What should people be getting?
Well, that's a good point. I think right now it's more or less one-stop shopping for the whole country, but in time I do think that can change. If you look at work from the Institute for Health Metrics and Evaluation at the University of Washington, Seattle, they're doing some predictive maps finding the rise of the Aedes aegypti mosquito here in Texas and the Gulf Coast that has the ability to transmit dengue and chikungunya and Zika virus infection and even yellow fever. So I could imagine if that continues to accelerate, we could start recommending brand new vaccines for some of these arbovirus infections, and as well as tick-borne illnesses and maybe our hookworm vaccine. So stay tuned. I think you're going to see some shifts in regional patterns in the coming years.
Well, Dr. Peter Hotez, we admire your passion. We admire what you've done for not only the United States, but for the whole wide world with your research and getting vaccines to the folks in many other countries. You have been a selfless humanitarian, and we appreciate that.
Oh, that's very kind, and thank you for giving this attention. And that also is an important service, helping me get the word out. So I deeply appreciate it.
Well, before we go, and the last time we had you on was during the COVID time. It seems like forever ago, but it wasn't. Are we going to see a resurgence of that before we leave? I know this is something I'm just kind of throwing at you at the end here, but talk to us about that.
I just like we're seeing the rise of mosquito-transmitted virus infections. Remember, both coronaviruses and Ebola viruses, filoviruses, are natural viruses of bats, and with climate change patterns, what you're seeing is bats are coming into closer contact with people. So I anticipate we'll see increasing jumps of zoonotic spillovers of coronaviruses to people. Remember, we had SARS-1 in 2002. We had Middle Eastern Respiratory Syndrome, MERS, a coronavirus 2012, now COVID-19. So I would expect we'll have a fourth one, in the coming years. And the other thing that's happening is not just the bats coming closer to the people, but because of urbanization and deforestation, the people are coming closer to the bats. So I expect that this, unfortunately, could be a new normal.
Well, you can learn more about Dr. Hotez's books, his work that he's done over the years, his numerous awards. He has a website, peterhotez.org, and we'd ask you to consider making a donation for Dr. Hotez's noteworthy work in combating the spread of disease and the spread, of course, of medical disinformation. He's at Texas Children's Hospital for vaccine development, and the website there is texaschildren.org. You'll find that all on our website at WBBZ-TV. Dr. Hotez, thank you for joining us on your Hometown Health Connection for this very important conversation.
Great. Thank you again. I appreciate the opportunity.
You're welcome. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.